number 22. A 22-year-old mother of one child is admitted for the management of Rh Isoimmunisation. Sorry, Amma Rh Isoimmunisation. Walter admit karla තියෙනවා. She is at 28 of PDOA. Estimated fetal weight babage 1.2 hari. Amniotic fluid volume is normal. You know that when there is Rh Isoimmunisation, if the baby has developed another, if the antibodies cross the mother and went to the baby, that might lead to fetal anemia. Babage RBC damage destroy වෙනවානේ. So babage RBC destroy වුණාම fetus will develop what? Anemia. When the fetus develop anemia, what happened? Fetus heart goes into failure. So when there is heart failure, you know that there will be fluid accumulation in all the cavities. Peritoneal cavity, pleural cavity, skin edema, bowel edema, scalp edema, and it also lead to polyhydramnios. So that is called as hydrops fetalis. That is called as hydrops fetalis. So මෙතන කියලා තියෙනවා තාම බබාට antibodies කියලා hydrops fetalis වෙලා නැහැ කියලා. So she had a rising antibody titer. This is the usual way they ask a question. ඒ කියන්නේ antibody titer දවසින් දවස වැඩි වෙනවා. During follow-up, they have found that antibody titer is increased with day by day. So when the antibody titer is increasing, you know that baby is at a high risk of what? Developing what? Fetal anemia. So you have to check the fetal well-being. ඒ කියන්නේ බබා anemia එනවද නැද්ද කියන එක බලන්න ඕනේ. So you can check the middle cerebral artery Doppler. That is the gold standard. ඒ කියන්නේ middle cerebral artery Doppler එකේ pulsatile index නැත්නම් resistant index එක වැඩි වේද අඩු වේද when there is fetal anemia. What do you think? Pulsatile index or the resistant index will increase or decrease, you think? So when there is anemia, what happened? As a compensation, the fetus try to provide blood to the brain. Middle cerebral artery and brain එකට supply කරන්න ගන්නේ. So even though there is anemia, to compensate that, the vasculature increase. Vasculature diameter increase වෙනවා. So middle cerebral artery ke pulsatile index or the resistant index drops. And what happened to the middle cerebral artery peak systolic velocity? What do you think? Will increase or decrease? Peak systolic velocity in a case of fetal anemia. That increases. Hurry. Pulsatile index drop to increase the peak systolic velocity. Is it clear? මෙහෙම indirectly අහන්න පුළුවන්. That's why I'm using every words that are possible. Did you guys understood that? Understand or not? Resistance අඩු වෙලා peak systolic velocity වැඩි වෙනවා. That's the word. That's what I wanted to explain. Right? So that is what. So what happened to the CTG? If there is fetal anemia, what is the CTG pattern you can get? මේකත් මං කියලා දුන්නා. CTG එක මොන වගේද? In case of fetal anemia, what happened to the, what's the, very good, sinusoidal pattern. So I'll show what is the sinusoidal pattern. What I do. මේක තමයි sinusoidal pattern when there is fetal anemia. So there's an invasive method. ඒ උනාට මේ දෙකෙන්ම හොඳ මොනවාද? It is middle cerebral artery Doppler rather than going for the what? This CTG. So earlier they used the invasive procedure to detect fetal anemia. What is it? What is the invasive procedure they used earlier? දැන් අපි use කරන්නේ නැහැ. What is it? Earlier, what they used? Or the invasive procedure they used to detect fetal anemia? Come on. What was that procedure? Called as, they use amniotic fluid bilirubin level. But nowadays that is not used. Alright? Amniocentesis karla, amniotic fluid bilirubin. When there is fetal anemia, that is hemolysis. Hemolysis will lead to increased bilirubin. That bilirubin will there be in the amniotic fluid. So amniotic synthesis karagena, you can check the bilirubin level. But it is an invasive procedure which will increase the risk of miscarriage. So nowadays, what we are using is the gold standard is what? Middle cerebral artery Doppler. So answer D. Is it clear enough? Do you want further explanations? No, right?